So one of the first things people tend to ask us in clinic is, why aren't I getting better, and how long will it take to get better? And usually the answer is very, very simple. If I cut myself, how long will the cut take to heal? And the answer is usually around about 3 or 4 weeks. So it takes 3 or 4 weeks for little fibroblasts, little cells to get to the site of the injury, to produce collagen, the collagen to knit the tissue together like a scab, the scab then to remodel into skin, and then the skin to completely form. Around about 3 or 4 weeks. And in biology, we call that intention healing. So generally speaking, tissue structures, if they're able to heal optimally, only take about 3 or 4 weeks to heal. And so normally we say to patients, how long will it take to heal once you've had an injury? 3 or 4 weeks. The problem is that sometimes the structures are not able to be left alone. Maybe you've probably got a problem in your hip, or you've got a problem in your ankle, and you can't avoid continuing to reuse it. And when you continue to reuse it, you obviously cause a little bit of continued irritation and inflammation. And so therefore, the problem now is the new structural loading that you're putting through that structure more than actually the body's internal ability to heal? And if it is more, if you're using it a little bit too much, then you're going to find that probably the healing will be delayed, because in a sense you keep re-injuring it. But in any event, most injuries heal as well as they're going to heal within around about 3 to 6 months. And so if you're still in pain after 6 months, something very, very different is happening, because the structure should have healed. And in that case, generally speaking, what's happening is if you're still in pain, say 6 months, a year, 2 years after the original injury, then the problem now is that the brain is trying to protect you, and it's trying protecting you by contracting the muscles around the joint, which is leading to suboptimal efficient movement. That suboptimal efficient movement is causing continued irritation, continued inflammation, and that inflammation then is causing increased pain. The solution to all that: identify what the compensation is. Identify why your nervous system is trying to protect the foot, the ankle, the hip, the injured structure in that way. There may be emotional involvement, there may be compensation from another joint, there may be an inflammatory issue to take care of, whether that's dietary inflammation or inflammation local to the joint. But in all sense, the key to getting you better is actually identifying why the normal process of recovery has been impaired.